pn7. Q. The LPN/LVN is caring for a client with a diagnosis of diabetes insipidus. Which of the following clinical manifestations is expected? A. Polyuria. B. Nosebleed. C. Clot formation. D. Oliguria. Rationale. Symptoms of diabetes insipidus include excretion of large amounts of dilute urine and extreme thirst. The clinical manifestations listed in options B, C, and D are not associated with diabetes insipidus, so they are incorrect. Q. The nurse is caring for a client who is nauseated and in danger of aspiration. Which action would the nurse take first? Administer an ordered antiemetic medication. Obtain an ice bag and apply to the client's throat. B. C. Turn the client to one side. D. Notify the physician. Rationale. Turning the client to the side will allow any vomit to drain from the mouth and decrease the risk for aspiration. Answers A, B, and D are all appropriate as nursing interventions, but a patent airway and prevention of aspiration is the priority. Q. Which of the following laboratory results would cause the most concern in the immunosuppressed client? A. Sodium level of 50 mg DLB. A. Blood glucose of 110 mg DL. Ca. Platelet count of 100,000 qmm. D. White cell count of 5,000 qmm. Rationale. Normal sodium is 135 negative 145 mg. So this is a low blood level that should be reported. Answers B, C, and D are normal or near normal readings. Q. Dalteparin fragment has been ordered for a client with pulmonary embolus. Which statement made by the graduate nurse indicates inadequate understanding of the medication? A. I will administer the medication before meals. B. I will administer the medication in the abdomen. I will check the PTT before administering the medication. D. I will not need to aspirate when I give dalteparin. Rationale. It is necessary to check the PTT as well as administer in the abdomen. As stated in answer C, it is not necessary to administer this medication before meals. Thus, answer A is incorrect. Answer D is incorrect because the nurse should not aspirate after the injection. Q. A client at the clinic reports to the nurse, I have trouble seeing signs at a distance, but no trouble seeing things close up. The nurse identifies the correct term for this vision problem as A. Myopia. B. Emmetropia. C. Hyperopia. D. Astigmatism. Rationale. Myopia is nearsightedness due to the cornea being too steep or the eye being too long. This causes light to come into focus in front of the retina, resulting in blurred distant vision. Answer B is normal vision. Farsightedness is blurred near and often distant vision, as in answer C. Astigmatism occurs when light rays focus in multiple points, causing blurred vision not related to near or far vision. Thus, answer D is incorrect.